When Singapore confirmed its first coronavirus patient, the Ministry of Health activated its contact tracing team to identify individuals who have had close contact with coronavirus patients. But how is contact tracing done, and what are some of the challenges involved? Dr. Oliver Oh and Mr. Priyam Raj, who lead the contact tracing team, explain. When a coronavirus case is confirmed, the hospital will create a detailed map of the patient's movements and contacts 14 days prior to the onset of symptoms.
So once we have a confirmed case, we initiate this process called activity mapping. This is done by the hospital at which the patient is warded at. So the healthcare worker caring for the patient will interview the patient and basically get information on where he has been prior to the onset of symptoms up to the point that he was admitted and isolated in the hospital. So this is a full movement history of the patient, all the places he has been to and the people that he had contact with.
The contact tracing team tries to verify the activity map, including with airlines and transport companies, and identify a list of close contacts who are those at risk of infection.
There's no hard and fast rule to define a close contact, so it depends on the length of exposure. For example, whether the person was wearing any personal protective equipment, and also the type of activity they were involved in. So we have to take all these things into consideration before we decide whether a person is a close contact. Assuming the patient was infectious during the flight, then we will actually obtain the flight manifest through the airlines, and we'll then identify persons who are seated within the certain vicinity of a case, 2 rows to the front, 2 rows to the back, and the row itself, so a total of 5 rows.
Callers then reach out to these close contacts and check if they are feeling unwell. Close contacts who are well will be served a notice of quarantine and given the choice of staying at home or going to a government quarantine facility for 14 days from their last contact with the patient. Those who have coronavirus symptoms are hospitalized in the isolation wards and tested for the virus.
For the contact tracers, currently we have activated 7 teams of 10. At any shift we have 3 teams on duty. During peacetime, we have established a pool of contact tracers, and they have been given regular training on the contact tracing process.
I guess some of the challenges will probably be trying to locate individuals who are foreigners, because they don't necessarily stay at one location and may not have a working phone number, so trying to contact them and locate them can be quite challenging.
Another team analyzes the data from all patients to see if there are any overlaps, including the places they have visited or people they have met. Any linkages are flagged.
If the public does get a call from the MOH Contact Tracing Centre informing them that they have been in contact with a case, we would like to advise them to be cooperative to provide as much details as they can.